A proud supporter of this program, Riverbend Food Bank's vision is a hunger-free Iowa and Illinois.
Whelan Presley Funeral Home and Crematory has been serving Quad City families since 1889. Whelan Presley Funeral Homes are located in Rock Island, Milan, and Reynolds and are proud supporters of WQPT.
Why is COVID-19 hitting some parts of our population harder than others? And the one group that's helping the homeless at perhaps its biggest time of need. Tonight in the Cities. You'd think that pandemics would treat us all the same, but it appears that's not the case. No one is immune, but it appears that some people are more at risk. Hispanics in Iowa make up a disproportionate number of cases. African Americans in Iowa as well as Illinois do as well. Community health care treats many of these people who would otherwise fall through the cracks, and CEO Tom Bowman talked with me outside Community Health's curbside checkup last week. You always see, of course, a disproportionate number of minorities and the disadvantaged, but are you seeing more COVID cases among those populations?
Yeah, it's been very interesting and something we certainly watch closely here at CHC because we do, as you mentioned, serve generally a higher percentage of minorities, non-English speakers, and others. Here at CHC, where we're seeing probably the largest increases have been really in our Asian population, which includes the Burmese refugees and immigrant population here in the Quad Cities, and also in the Hispanic population. So I know in the state of Illinois, just this week, the Illinois Department of Public Health has been really watching the rates around the African American community in and around the Chicago area, where you've seen a significant portion of the COVID-19 deaths. So in our area, however, we really are seeing a greater influx, at least at CHC, really in that Asian, Burmese population, and then also in the Hispanic population. What do you attribute that to? Well, you know, there's a lot of different reasons. When you think about the populations that we serve, many times most of our patients fall into that low-income category, and so I think it's too early to say specifically on COVID-19, but you would see with our patient population traditionally, low-income populations and others, they have always had more underlying conditions disproportionately to the greater population. And so COVID-19 in and of itself tends to affect people with underlying conditions like diabetes, obesity, heart disease, HIV, and others. All of those disease states are more prevalent in low-income populations who we serve every day. And so it sort of is consistent that you would see higher degrees of COVID and you would see higher degrees of deaths in those patient populations. The head of LULAC in Iowa was pretty much insinuating that at least with the Hispanic population being so family-oriented, with so many people that may be residing in one location, that is also attributing to some of these numbers as well. Yeah, generally with low-income populations, a lot of times they're living in rental housing or large-scale housing, and so there just isn't as much of an option for social isolation as you would see in the general public. So I think that plays a role. Also, there's most of the time low-income populations and the patients we serve have a greater tendency to use mass transit, public transportation, where they come in contact with others. You'll also see that they tend to work jobs where they don't necessarily have the option not to go to work. And so, you know, for fear of losing their employment or just missing out on those wages. And so a lot of times they will go to work sick and come in contact with others who may have been exposed, which is other ways that it can be transmitted. Now, we're talking to you on a Friday afternoon, and behind you, you've got your curbside care going on. That's been an ongoing effort by Community Health, has it not? It has. We stood up our curbside care team starting really on March 16th and 17th, and we've been doing that ever since. We've really pretty much closed the interior of our clinics to any patients at this point, so we've really ramped up our telehealth options so patients can connect with us first through the telehealth, and then they're able to come to curbside care. And what we're doing with our curbside care is not just COVID screenings. That's actually a small portion of what we do. our patients can still connect with their regular primary care provider. They can have a telehealth visit, and if there's additional things like labs or physical exam, immunizations, vitals, those types of things, those primary care providers can send them through curbside care, where we have teams that can collect that information for our PCPs. So our whole goal is to make sure that our patients aren't putting off necessary preventative screenings, annual physicals, just wellness checks, management of their chronic disease. All of them still have access to their doctor, and then we utilize the curbside for extenuating that and lengthening those services. It really helps us limit the amount of personal protective equipment that we use by having these teams dedicated. It's not we're not burning through the PPE as quickly, and it's really efficient for our teams, and then also our patients have loved the telehealth option as a first option for us.
And Tom, are you seeing any surge at all in your population of people either with COVID-19 or even with basic medical care that they need right now?
You know, I would answer that two ways. Initially, back in early March or mid-March, we did see a significant downtrend in patients avoiding coming into the doctor's office, and so we moved very quickly to ramp up our telehealth services on the medical side and behavioral health side. And so we have actually not seen a huge surge, but we've been getting back to about normal for the number of visits that we would normally see, but it is being done through video and phone conferencing with our providers, and then also our curbside care. Out here at Curbside Care, where we do our COVID screenings, we have just in the last week, we've seen an uptick in the number of patients that come through who are sick and who meet the criteria for being screened. And so we are seeing a little bit of a surge there, but that's something that we are prepared for, and if we need to add additional staff to this team, we will do that so that we can continue to meet the needs of our patients.
Well, now we know that there have been hot spots throughout the area, and community health is not only in the Quad Cities, but also Muscatine and Clinton. Have you been noticing that as well? Any hot spots at some of your other clinics?
You know, we have not seen too much in Clinton and Muscatine. I know in the Muscatine area with the Tyson plant in Columbus Junction, I had just heard from community partners that there were patients in that area, but we did not. We just opened in Muscatine, so we haven't had a large patient base established there. Here in the Quad Cities, we do see a fair number of patients that are coming from large-scale employers, and so we're seeing a little bit of uptick in that, and we are working with the health department to see if we can help in any way with additional testing or additional services for those patients.
We have been talking about a potential surge and that the numbers may peak right around now until the middle of May. Is this something that you've noticed? And it's hard to crystal ball whether or not you're actually flattening the curve until after this is all said and done.
Yeah, it is really hard to crystal ball. In fact, you know, we've heard it just keeps getting pushed back. So you think you're a week or 2 weeks away, and then you know, the goal line gets moved a little bit. So I think that's actually not necessarily such a bad thing here in the Quad Cities. We didn't see the uptick in numbers really come until well after some of the other areas like Chicagoland area and parts of Iowa around Lynn County and Johnson County. So we kind of started to rise later. I think we're kind of in the middle of that. I am very hopeful that we will see this start to level off in the next 2 weeks, which is kind of what has been predicted for this area. So it'll be hard to tell for sure, but we're hopeful that that's the case.
What about supplies as well as nursing staff and manpower that you have? There's so many concerns about whether or not you have the equipment you need or whether your personnel are burned out and can keep going at this pace.
Yeah, well, our staff are pretty resilient, and they know that we're here to serve our patients, and they want to serve our patients, and so they've been fantastic. I don't know where they get all the energy, but I couldn't be prouder of the team that we have here. We have taken a lot of steps to really reduce our PPE usage. We did have to shut down our dental clinics to everything except emergency care. They go through quite a bit of gowns and masks and things, and so we were able to redirect a lot of those supplies over to our medical side. But then by setting up the curbside care, that really, and dedicating one team that is outfitted with the full PPE and really reducing how many people actually come in contact with a patient who is suspected of COVID, we're not having to take on and take off as much of the PPE as we had. So we're confident that we'll have the supplies that we need. We're careful about how much we use, but we're sitting okay for right now. If there's a huge surge, we'll see what we need to do, but we feel like we are able to keep pace for right now.
One of the real critical problems, at least as far as the response has been from the beginning of this COVID-19 crisis, was really the availability of tests, especially quality tests that were actually working. Have we already reached the point where that's no longer a factor?
Yeah, testing was a real challenge early on. We have done a much better. We work with a reference lab, LabCorp. They've made more supplies available to us so that we're able to keep pace. The state of Illinois and the Rock Island County Health Department has also supplied us with additional testing for our Illinois-based practices, and so we do feel like we're ahead of the curve on that, and we have enough to do what we need to do. So it did take a while, though, to catch up, and we had to be very, very restrictive early on with who we would even allow to be tested. And so it has opened up quite a bit. It's still not a just walk in and a drive-through type of a testing facility. We want patients to be evaluated by a provider first to see if they really need the testing. And so we're still being somewhat strict, but it has opened up quite a bit, and we have many more supplies than we had before from a testing perspective.
Well, and right now a lot of us are up to a month, maybe a month and a half for some people as far as being sheltering in place, or at least a major disruption in the way we live our lives day to day. And you can already tell that people want to get back out. They want things to open up. They want to be able to get back to a normal life. What are you saying to people right now? Because you know that there could be a peak that's still to come. You also know that there are so many people that have underlying medical issues that could really be in more danger than somebody who's more healthy. Do you have real concerns that people are perhaps going to jump the gun, so to speak, and get back out into the public?
Yeah, I do have concerns. I think public health, I think both governors in Iowa and Illinois have been very clear about expectations that people still need to socially distance, stay at home when they can, work from home if they can. Employers need to continue to be flexible with their staff if they're sick and keep them home. So I hope that people will continue to follow those guidelines. We are a month in, or a little over a month since a lot of these policies were put in place, but that, in the grand scheme of things, and how much we've been able to slow this virus down in the U.S. compared to what the early indicators were, I think does show that we've been effective. So I hope people will hang on a little bit longer until we get past the peak in this area. And then, we will need to start loosening things up. That's just going to be the natural way that we have to go about getting back to business. But we're not there yet. And so I do hope that people heed the warnings of the public health departments and the governors in each state.
And here in the Quad Cities, Tom, you and Community Health are part of the COVID-19 Quad City Coalition, along with Genesis and Unity Point Trinity, as well as the health departments on Scott and Rock Island County. It's been a real, and emergency management services as well, I should say, as well as a lot of first responders. It's been a real teamwork effort. Do you see that as one of the pluses of what's happened as far as this pandemic is concerned, as far as the Quad Cities cooperation is concerned as well?
Yeah, I think the Quad Cities has done an amazing job. We've got two health systems that have worked collaboratively throughout this process and worked with CHC and others. We couldn't have, done it without their help as well. They've coordinated a lot of their activities with us and kept us informed about what they're seeing at the hospital, which helps us serve our patients. The two health departments have just been very proactive and put out a ton of communication to our community. Even as early as shutting down our St. Patty's Day parade, that was a difficult decision, but that was made in the interest of the public health in this area. So I think we've been extremely proactive. I've been very proud of the efforts here in the Quad Cities, and I think if we can continue to do that for the next few weeks, we will come out of this feeling very grateful that we followed those policies. I think early on we heard if we feel like we overreacted at the end of this, then we probably did things right, and I think that's the stance we took as with all the decisions we've made so far.
As you heard, Illinois is changing some of its restrictions come May 1st, easing up. One of them is easing up a little bit on hospital services, elective surgery and the such. For people that you serve in the Illinois Quad Cities area, what's going to change come May 1st as far as the services you provide?
For us, probably not a lot is going to change here at CHC. We really want to see a consistent downtrend in cases, and we want to make sure that curve is flattening probably before we start bringing people back in. It's something that we have a team working on, and we'll evaluate when it's time to start allowing more patients into the clinics. Certainly the dental operation being closed, we are actually doing some teledentistry to rule out emergency cases. And so that's been an interesting development for CHC, but dental will be one of those areas that we will probably focus on first for what is safe, what makes sense that we can bring in and make sure that our patients are safe and that our staff are safe and that we're not going to spread it within our buildings. And once we feel comfortable we can do that, we'll start doing that. But that'll probably be later in the month.
And you had mentioned earlier telemedicine is being used to a greater extent. Now you're talking about teledentistry.
Yeah.
This is kind of a whole new world for medical care in just the last few years. Do you think that could have a lasting impact because of COVID-19?
You know, I sure hope so. Telemedicine has been something health centers like community health care have been trying to do for a while. You know, there's a lot of policy changes that needed to happen at the state level for us to be able to deliver those services to our patients. But so many of our patients have transportation issues. They have difficulty taking work off to come in, or they have childcare challenges. So a lot of barriers to actually coming into the office. So this is another option in a way for us to deliver that care safely and effectively. And so I think it'll be something that we'll continue to do well past the pandemic.
And I'll give you the last word. What do you want to say to people who are a little worried about this long-term impact of this? Of course, as we were saying, there are people that have underlying medical conditions and they have to be careful through the summer. There's worries that perhaps the pandemic could come back in the fall. What are you saying to people right now?
Yeah, you know, we have a consistent message of, you know, take care of yourself. If you have the opportunity to isolate, do that. If you can work from home, that's a good option. You know, but then if you are going to be out, just use common sense for the most part. Stay away from people that are sick or that appear to be sick. Cover your mouth, wash your hands, all the things that public health has been talking about. I think if we do those things, we'll continue to be in a good place.
Community Healthcare CEO Tom Bowman joining us. April 1st has come and gone, but the census does continue. The Census Bureau says you can still take part in the nationwide count right now. It's easy, it's quick, and it's important.
The census counts everyone in this country, and that really means everyone. A hospital patient, yes, that person counts. Newborn Benjamin, yeah, little Ben now counts. Two families that live in the same house, sure thing, they all count. Or David, who's living in his cousin Daniel's garage, he also counts. The census counts everyone to make things better for all of us.
Bars, theaters, and many other venues are going to be closed all the way through May. It's been tough for the entertainment industry, and we want to salute the musicians in the cities who take the stage to share some of their own original performances. People like Jenny Lynn Stacy. She joined us at the downtown Moline Black Box Theater a few weeks ago to perform an original, so here she is with Nothing to Lose.
We were falling such reverie. Well, of course I can't eat, and right now I don't sleep. Well, I guess I'll just let things be. Close my eyes and just let them be. And I cry so hard just so I can drown my sorrows in bitter pursuit. And this world is setting me on fire. Now I know I've got nothing to lose. Well, goddamn, I've got nothing to lose.
Jenny Lynn Stacy and Nothing to Lose. And you can check her out anytime on her Facebook page when she joins her band. It's Jenny Lynn Stacy and the Dirty Roosters. Well, sheltering in place is hard enough, but imagine trying to shelter when you don't have a permanent one. Back in January, we talked to the head of Christian Care about the needs in our community. This is, of course, weeks before COVID-19 became a huge issue in the cities. Christian Care has changed many of its operations since that day, following health regulations to try to stop any spread of the virus. But Steve Gottson says there's still people in need, now perhaps more than ever.
Why do 600 of our neighbors not have a place to stay?
Well, Jim, that's a difficult question to answer because the answers are all different. When you actually sit down and begin to engage some of these individuals and talk about their stories, you're going to hear a wide gamut of stories, from lack of education, from a job loss, to a broken relationship, to physical disability, mental illness. There's a wide range of various needs, and we can begin to tackle one or here or there, another one suddenly pops up. So we need to continue to have shelters like Christian Care that are not targeted in one specific area, but are open to addressing, hey, you need a shelter, you need some food, come on in, we're going to do everything we can to help you manage.
But is this a cycle that can be broken? I mean, are you continuously seeing the same 600 people? I mean, or are you seeing, I want to hear success stories. And I know you have them.
Sure, we certainly do. And it's true that on the one hand, yes, there are some repeat people that we do see coming back. On the other hand, we have some wonderful stories of guys who have moved out. Just right before Thanksgiving, we had 4 gentlemen, in fact, who moved out into their own apartments. Now, it's only been a month, so we're going to have to continue to keep an eye on them to see how they're doing, how they progress. But we celebrate that. We don't want to be a long-term hotel for people. In fact, our goal is to usually have guys move out within the 4 to 6 month range and, again, get them into their own apartment. So we certainly do have success stories like that. We've got one gentleman, his name is Otis. He actually comes back now and volunteers. He lived with us for a little while. He had a physical disability we had to help him manage. He needed some help with his education. We were able to get all those things, got him moved into his own apartment. I'm really excited. He's, again, comes back every single week on Wednesdays to help serve as a volunteer because he recognizes the difference that Christian Care made in his life.
Is this a serious issue with a person who just is doing fine, and then wham, you lose your job, or wham, you get some medical bills you can't pay for, and then all of a sudden you're suddenly out on the street?
It is a serious issue because, again, it's that manner of scrounging around to figure out, what do I need to do? A lot of people that I talk to, the average person driving up, maybe they see someone on the side of the road asking for money. For many of us, there is an assumption that either these people are just playing a game or that they already know all the resources and they're just choosing not to do them. Now, in some cases, that is true. In other cases, they don't know what to do. As you mentioned, they just lost this job. This happened just the night before or the week before, and they're trying to put pieces together and figure out what in the world to do. So the more we can get out and communicate about the available services, the more we can continue as a community to support the available services, the better off we can do.
Because I do know that you have one-on-one case management, because you are trying to deal at the root of the problem if there is a bigger problem than what we see on the surface.
Exactly. Every one of our residents that comes in, they sit down with one of our client advocates, just as you addressed, on a one-on-one session, so we can figure out what's holding you back from that job, that apartment, from whatever that next step is. Let's identify what's holding you back, identify that need that you've got, and then provide the resources. Whether those are resources specifically at Christian Care, thankfully here in the Quad Cities, we have a wonderful network of social service organizations that we can really come together and say, hey, we're going to send you over here for this help. We're going to get you over here to get this job, whatever it might be. So we want to work with them, as I said, to lay out a game plan and make sure that, as I said earlier, this is not just a free hotel. Let's map out the steps that you need to take so that you can get back on your feet and become a contributing member of society again.
Well, like we said, you've been around for a little more than a half century, have you not?
Actually, even more than that. We were founded back in 1916, so we are celebrating 103 years.
So I mean, it's amazing the work that has been being done, but that work continues. What I'm saying is that nobody's really putting you out of business.
Yes, I wish I could say. That would be one of those glorious moments for anyone working with the homeless services, to be able to say we weren't needed anymore. Yes, the problem continues to persist because, unfortunately, as I addressed before, some of these needs pop up all of a sudden, pop up out of nowhere, and we've got to be able to handle and manage that.
Steve Gotson from Christian Care in an interview we did back in January. Now, Christian Care is still accepting all types of donations except for clothing right now. It is also trying to distribute sack lunches to so many people in need during this time. Well, we want to remind you that WQPT has some great online programs for you and your family right now. Go to our website at WQPT.org to learn more about PBS Kids program. It includes several interactive apps and games that make learning fun. Plus, check out PBS for Parents with an online resource including a section that helps moms and dads talk to their kids about the coronavirus. It's all free and family friendly, and you can check it out right now at WQPT.org. On the air, on the radio, on the web, and on your mobile device. Thanks for taking some time to join us as we talk about the issues on the cities.
A proud supporter of this program, Riverbend Food Bank's vision is a hunger-free Iowa and Illinois.
Whelan Presley Funeral Home and Crematory has been serving Quad City families since 1889. Whelan Presley Funeral Homes are located in Rock Island, Milan, and Reynolds and are proud supporters of WQPT.